Now getting straight to the topic for today's video is how is a vaccine made and how does it work? So vaccines contain tiny fragments of the disease causing organisms or the blueprints for making the tiny fragments. They also contain other ingredients to keep the vaccine safe and effective. Each vaccine component has a specific purpose and each ingredient is tested in the manufacturing process. Antigens. The antigens may be a small part of the disease-causing organisms like protein or sugar, or it may be the whole organism in a weakened or inactive form. Preservatives. Preservatives prevent the vaccine from becoming contaminated. However, some vaccines do not have preservatives because they are stored in 1-dose vials. The most commonly used preservative is 2-phenoxyethanol. Stabilizers. Stabilizers prevent chemical reactions from occurring within the vaccines and keep the vaccine components from sticking to the vaccine vial. Surfactants. Surfactants keep all the ingredients in the vaccine blended together. They prevent settling and clumping of elements that are in liquid form in the vaccine. Residuals. Residuals are tiny amounts of various substances used during manufacturing or production of vaccines that are not active ingredients in the completed vaccine. Diluents. A diluent is a liquid used to dilute a vaccine to the correct concentration immediately prior to its use. Adjuvant. An adjuvant improves the immune response to the vaccine, sometimes by keeping the vaccine at an injection site for a little longer or by stimulating local immune cells. So these were the ingredients used to make vaccines. But how are these vaccines actually made? Firstly, the vaccine undergoes testing to ensure it's safe while using. Now, evaluation is done to determine which antigen should be used to invoke an immune response. Once the right antigen is determined, human trials are taken in 3 phases. These phases are Phase 1, Phase 2 and Phase 3. In Phase 1, the vaccine is given to a small number of volunteers to assess its safety and check its effectiveness. In Phase 2 and Phase 3, vaccines are given to hundreds and thousands of more volunteers and they are then compared to a similar group of people who are not vaccinated. This is done to determine if the vaccine is effective against the disease or not. When the trials get over, officials in each country review the data and decide whether to authorize the vaccine for use or not. Once the vaccine is approved, it is then authorized for broader use. So this is how a vaccine is made. So that's about it for this video. I hope this was informative. Stay tuned to get similar information in the future and do it by subscribing to the channel. Now that's about it for this video. I'll see you in the next one. Till then, peace out.